After war, we have a war, we have economical problems, so this I think make a big problem, psychological problem in my country. So I want to become in this program and get master degree to help my society because really need too much help.
And as well, I have 6 years experience as a psychotherapy, and I worked with survivor of chemical attack in Halabja. And actually, this is why I decided to participate in this course. Of course, this field, especially trauma therapy, is really new in our society, and we cannot find it in our universities in Kurdistan, and this is new. Because of that reason, I decided to participate.
The big opening ceremony took place in Duhok in October 2017. The wide range of guests reflected the broad base of this unique academic endeavor. Representatives of the United Nations, the Kurdish government, the participating universities, and political institutions from Kurdistan and Germany were present. For the first time, this kind of international cooperation took place in the region to pool academic and financial resources. The Ministry for Science, Research and the Arts of the state of Baden-Württemberg financed the startup. The universities of Duhok, Villingen-Schwenningen and Tübingen staff the wide range of experts on trauma therapy and have developed a curriculum that is modelled after the European Master's Standard. Training trauma therapists is a dire need in northern Iraq. The Daesh reign of 2.5 years in the region did not only destroy houses and whole villages. Hundreds of thousands of people have been deeply traumatized. Around Duhok, there are more than 500,000 refugees and internally displaced people, but only one psychiatric clinic and half a dozen therapists. The Master of Advanced Studies in Psychotherapy and Psychotraumatology wants to educate sufficient therapists to meet this need in the near future, at least to some extent. To apply for the MA, students must have a bachelor's in psychology, medicine, sociology, or healthcare science. The study plan focuses on the theory and practice of cognitive behavioral therapy. The professional requirements are designed according to the Regulation for Psychological Psychotherapy in Germany. Due to the participating institutions and teachers, the program is a model case for transcultural transfer of knowledge. Professor Kizelhan has treated war refugees from all over the world for 20 years. He teaches at the Corporate State University, Villingen-Schwenningen. Dr. Ottman has studied in Germany and now teaches in Duhok. These are the basics for the development of our curriculum. But we will change and adapt once we realize that things are different here in northern Iraq. For instance, there is hardly any understanding among the local population of what a psychological illness is. The theoretical part of the master's studies covers a wide range: clinical psychology and psychopathology, cognitive behavioral therapy, ICD-10F diagnosis, psychology of culture and identity, trauma and post-trauma therapy, to name just a few. During the whole course, IPP master's students are obliged to perform therapeutical work. One stop, a clinical setup in Duhok. Students sit in therapy sessions and discuss the cases seen with the therapist. Depending on their prior experience and professional background, they take part in supervised therapy as well. Supervision and intervision of the students' therapeutical work are also mandatory. It looks like circus training, but it's not. Students find out how they deal with multiple challenges at the same time. How do they assess their own capacities, strengths and weaknesses? What about their self-perception and the image others have of them? Self-evaluation is a recurring and important part of the IPP curriculum. Quite a number of IPP students have been exposed to war and violence as well, just like many of their patients. Dr. Kaiser is teaching a very important therapeutic method, narrative exposure therapy. She joined the international team of lecturers for the first time in spring 2019.
Before I came, I thought, in a place of war, you expect young people to be kind of disillusioned, maybe a bit hard, maybe broken also in their own personalities. So it's a really big surprise to see that these people are so lively, so engaged, so empathic and warm.
The NET therapy visualizes good and bad events in the life of a patient. In the therapeutic setting, the patient can work through the emotions of those events. Due to their own experience, many of the students know exactly what their patients went through.
They bring, or the personalities they bring to work, will enable them to have two qualities. One is the intellectual capacity, the other one is the empathy and the compassion they show for the patient. So it qualifies them to become very good trauma psychologists. Yeah.
One of the many refugee camps around Duhok, tens of thousands of displaced people and refugees from Syria and Iraq are doomed to live here. The IPP students know these people very well. They have been coming to the camps for 2 years as part of their mandatory practical work. Detailed knowledge of their situation and mutual trust is part of the basis for potential therapeutic success. This man suffered for the most part of his life with very low self-esteem. This, in turn, caused the people around him to label him a stupid idiot. Before joining the IPP, Ziad Basha had worked as a therapist for 8 years. In his therapy, Ziad Basha uses visuals and narrative exposure therapy.
We practice here and we found it's very effective because we used a lot of emotion and we used a lot of body sensation and make them to confront with their problem. And we found it's very effective and helpful. Our patients, when they give us feedback, they tell us their life it was changed.
Before I came here, I had problems with self-confidence. Now I feel better and relaxed. I have good in my life and think about the future. Most of these children never had a happy childhood. Instead, they had to suffer war, violence, and the loss of loved ones. But when the students from IPP come, there is joy and laughter. For a brief moment, they feel what childhood should be like. Alam Yunis is a mother of 4. She treats a number of children in this camp. For 2 years, she has met this girl on a regular basis in the camp. But today, something happened that Alam Yunis did not expect at all. One of my teachers explained to me that when you love someone, you can give them red flowers. I love you, and therefore I bring you flowers. They are related to spring in our region. After the meetings with you, I feel very comfortable and more confident, and more in love with me and other people, such as my family, my friends, or the teachers in school. You give me the power to do things that are more positive in my life. So far, the transcultural transfer of knowledge has worked. The reason? The students were given the choice to choose in the field with the patients what helps and what doesn't.
Dr. Kizelhan told us, you decide, you do the research, you cope this program and this Germany way and European way for the treatment with your culture, with your society, how you adapt, how you cope. It is like you make for this society a special way for the treatment.
In a few months, the students will deliver their mandatory master's thesis and take their exams.
The most important thing to me is I'm occupied with very new scientific approaches in dealing with psychopathologies. And also I can share what I have learned here with my friend that they hadn't chance to join this program. So it's a good chance to spread what I have learned here to other people that work in mental health sector. So I think this is the most important thing to me.